WHIV-LPFM in New Orleans. We are Radio Null HIV with programming. That's right, programming dedicated to human rights and social justice. WHIVFM.org. We honor independent voices. We are not a radio station with a mission. No, we are a mission with a radio station that is to end all wars. Hello, welcome to COVID NoiseFilter, the daily hour-long show, but now it's every other day. Before we get started, let me take care of one quick, oh no, it's not here anymore. I can't even do that anymore. I guess no longer. My name is Dr. Mark Allen Derry, and I'm an infectious diseases physician here in New Orleans. And sitting across the digital divide is my friend and yours. Say hello, Doc Griggs.
Hello, Doc Griggs.
How are you doing, Doc Griggs?
I'm good, man. Good. We're a typical surge posture, I guess. Yeah, surge fatigue.
It's funny that it's typical because this is going to start happening more and more regularly, right?
Yeah, like even after we get through this one.
Right. When we get through this one, number next.
Yeah,
this is around the corner. How's it been going with you? It's still lots of phone calls and people reaching out.
Lots of phone calls, lots of impromptu meetings. Yeah, like it's things are busy. Things are increasingly busy at all times of the day and night. So we've been here before, so we just got to stay in shape for it.
I just want to, in the spirit of honesty, and you and I are very honest and have been honest with things before in the past. Right before we got on air, we started talking about we're both tired.
Yeah,
we're tired. Right?
Well, we're really, really tired. I put the glasses on to try to hide the fatigue. It's tired. I need a nap.
Yeah.
I think I've averaged about 2 to 3 hours of sleep. I think I had an hour and a half last night because things are going on. People are starting to panic.
Well, it is panic time.
What's that?
It is panic time.
Yeah, it is. It really is.
There's a time to panic right now.
Yeah, today. Yeah.
And if you're not vaccinated right now, it would be panic time. Absolutely. Following along our tradition of Fridays, I am drinking a hard seltzer. Doc Griggs is not. So cheers to all of you. Can't drink beer anymore since I developed my gluten intolerance. So I am having now to sustain and enjoy cocktails in the form of a hard seltzer. So
he's doing a beverage and I'm doing a yogurt because I tend to forget to eat. I'm stressed. So I just really went hard on a strawberry yogurt.
So I'll answer this one because without being able to talk about behind the channels or behind scenes sorts of things, let's just say that somebody was very vocal about this, White Linenite, and so somebody was very happy when it got canceled. And so it would have been massively irresponsible, and it would have been hard for me to laugh about what's going on at Sturgis, knowing about what was happening. By laugh, I don't mean laugh, haha, laugh as in aghast. But White Linenite being canceled was 100% the right thing to do, and there was a lot of politicking in the background, and so I'm glad that it finally worked its way and the right thing happened. Doc?
Yeah, there's an amazing question that followed. Again.
I would wonder if that's going to actually happen or not.
Yeah. We have a lot of there are a lot of things taking place right now that again, people are surprisingly calm, and I'm not sure if that's another manifestation of anxiety. But the numbers are really going up, and it's just not prudent to do large crowds.
And the idea of doing it was was stunning. It was funny. Yesterday, I got that's good to know. This is actually an event that I actually like. Midsummer Mardi Gras. I only had gone to once. Liana went and danced with the Muffaladas 2 years ago, and it was the first time I'd gone in 15 years, and it was a lovely event, but it shouldn't happen. It shouldn't happen at all. And in fact, Eric, let me ask you something. I'm going to ask you some advice live on air. So next week, one of my bands, Turbine 6, is supposed to be playing at an open-air car show.
Open-air car show.
Right. It's like a 4 o'clock show.
In New Orleans.
New Orleans.
Yeah, what's the anticipated population?
I have no idea. It's spread out, though, because car shows are spread out.
Yeah, I mean, well, you're not going to know. I don't know. You're not going to know the vaccination status of everyone there.
But it's open.
Yeah, whether it's open or not. I mean, to be quite honest, hey, congratulations, Carla. Whether it's open or not, again, the air that we're all breathing right now is saturated with 1,000 times the amount of virus, knowingly or unknowingly, than it was last year. So there's that.
Right, but even outside, though, would you recommend not to do it?
If it's not, yeah, well, I'm always going to recommend not to do it because there's 1,000 times the concentration of virus in the air right now, unless you do it with a mask. And I mean, you wear glasses.
No, I'll be masked. I'll be double masked during the show. No question about it.
It's outdoors. Yeah, Elizabeth put it up. I was just about to ask, are they going to have proof of vaccinations?
So I don't know. I mean, that's where we should be going. But before we get to that, I want to show you this. That the crew of Oak is thinking of doing a party at Southport Hall instead of Midsummer and Mardi Gras. So watch as our heads.
Yeah, I mean,
massively irresponsible. Massively irresponsible. Hello, Tamiko. Good morning to you. Signing in from Japan.
So here's the difference between last year and this year is that we are. I mean, you have to give us credit for trying and having these conversations like we're having right now, because we do know better and we do know more than we did last year. We're wiser, but the thing is, we're not wiser to Delta. The Delta variant is novel in and of itself. The sniffles and sneezes and the cold symptoms aren't things that we thought about last year. The fact that you're vaccinated and you might have mild sniffles and sneezes. The fact that the recommendations have been updated, that even if you're vaccinated and have been exposed, you need to get tested. If you do, should you decide to do it, like Alan, I would get tested 3 to 5 days after that, just in case, because we don't know. Like last year, we freaked out about the kids going to school. You and I did, really.
Oh, whoa, wait till you see the rundown. There's news in red states that are not masking. Wait till you see the rundown, but go ahead. Point well taken.
Yeah, well, I'm saying that we were wrong because we're trying to figure out, if you can remember the very beginning of all of this, when I was saying that it's like having you have a house full of cousins, and the coronaviruses, they act like this, but there's that one cousin that climbs out the window in a season that he's not supposed to, he or she is supposed to, and they do things that you can't predict. Well, that's kind of where we are with Delta variant, and we won't know how it behaves until we can get more testing. And it looks like testing's going up because people are freaking out. So until then, I mean, you just have to make the most informed decision that you can and be willing to accept the consequence. I mean, if it's too crowded, have you gone somewhere? I know I've seen you because we've done it at the same time. You look at an elevator, be like, nope. Wait on the next one, be like, nope. You know what? I'm just going to take the stairs. I've gone places and seen the crowd and not gone in. I've gone places and actually went home because I got frustrated. So you just it's kind of game time decision. Pretty soon we're not going to have a choice of what to do. The virus science always tells us what to do if we wait long enough.
Well, that's in the rundown too. As to Jen Psaki, the press secretary for President Biden, made some comments about what their thoughts are about lockdowns. Hint: it's not likely to happen.
No.
So but
to that point though, that does not rule out snapbacks and restrictions.
Yeah, agreed. And I think that we should be getting to that. I mean, think about this. We canceled St. Patrick's Day for far less cases, and we almost had White Linen Night. We probably this show, if White Linen Night was not canceled, I bet you this show would just be nothing about what are we not canceling White Linen Night? 100%. It's funny that we were reacting far more appropriately last year with a less virulent and a less infectious bug. We know more now. We know that it's one of the most infectious organisms known to humans, and yet we're just still kind of dilly-dallying.
Yeah,
right?
so part of that is you hit it on the head as to the reason why. It's a false sense of hubris, right? We think that we've been through this before and we can treat this in a way that we know that we already have. Like, okay, I got this. We know exactly what to do. And again, the Delta is proving us otherwise. I keep going back to the fact that there's 1,000 times more virus in the air that we're breathing collectively, knowingly or unknowingly, and we still don't know exactly how it's going to behave. Like, so we got an A, well, no, we got a D on a test last year, but because we think we're taking the exact same test, we think they're going to ace it, and we're not, because there might only be, out of 25 questions, there might only be 3 that are applicable to this new thing. So we're going to see. I don't know how long this thing's going to last. I mean, at first we were saying we'll see a surge through August, and then all the things that I've been reading that it's today, they're saying that we could surge through September. Like, we just got to watch. I mean, every day we got to stay on top of the numbers.
Well, like we say, August is going to be an ugly,
rough.
difficult month. Like, there's no question about it. It's going to be a super, super, super rough month. Real quick.
Did you know numbers? Did you see that letter that went out to everyone from the Louisiana State Board to all the providers?
Yes, yesterday, right?
Yes, and it said that 16% of Latinos and Latinx have been vaccinated in the state. 33% of African Americans and 52% of Caucasian or European Americans. Those numbers leave a lot of people at risk, and we're getting better because the numbers are bumping up. We're slowly getting there, but the point is, until we can reach a point where everyone takes this seriously, even if you're making the decision as to whether or not to get vaccinated, to wear a mask and decrease the amount of available virus in the air for everyone else to breathe, if we can we all just agree on one thing, then this thing won't have to be protracted for so long, because every minute, every second, every day, every hour that this thing is around, we're making the likelihood of something bigger and scarier to take root. I mean, we haven't talked about Epsilon. There's Epsilon that started in California that's raging in Pakistan right now. That's another variant of interest. And we've talked, I don't even want to talk about Lambda because, yeah, whatever. Yeah, my bad. I'm sorry. I'm tired.
It's all right.
That needs a nap and a hug.
Yeah, well, I'll be taking a nap as soon as the show's over. That's for sure.
Yeah.
Real quickly, with drinking alcohol, a couple of beers or shot before being vaccinated, hamper vaccination efficacy? Very unlikely, no. Probably not a good idea. As a doctor, we don't like when people show up drunk or stoned, which happens regularly. So don't show up drunk or stoned to the doctor's office. Just don't do it. But if you did do it, it would not be a bad thing. I can't wait to hear about the very bad decision. I don't think I have it down. And then last I had when we brought back masking outdoors, you got me. I don't know.
Snail's pace. If we keep it up, it's coming.
Doc, before we go to the stories, what did you talk about on the news today?
So this morning we talked about we addressed the myth of fertility and the vaccine. The issue is that someone took a kernel of fact and extrapolated it out. There's a protein called syncytin-1 that's found in the placenta of mothers and children. The placenta. It's also found in the spike. They share like a few common codes, genetic codons, right? Just a very few. The codes. It's like it will be the equivalent of comparing. I've heard this example. It's comparing an alley cat to an elephant and saying they're the same because they're great. Taking a vaccine does not affect your fertility for men or women. However, being infected with COVID-19 does. Women are affected the numbers, they fare significantly worse than other women and men if they should contract the disease. Men, they have a reduced, they have found, if you remember last year, we said that they found COVID-19 in the semen, in testicles of men that contract COVID-19. We also know that COVID-19, the infection, can cause erectile dysfunction. So the benefits far outweigh the risks with taking the vaccine. So we had to debunk that. And then we talked about the brain fog, and that, it's proven in 50% of the studies, some of the studies that they've done. And they're varying studies, so the N is different, 300, 1,000, the whole nine. But they're just finding that brain fog is not associated with level of severity. It can be an acute or mild infection, or acute and for months out, and they're trying to see how long it lasts. And that means forgetfulness, cognitive function, executive decision making, like that. And I think that's the extent of it. So it has to do with the potential brain inflammation and decreased oxygenation. So the bottom line is get the shot.
Thank you. I am always astounded and love to hear your deep, how you're able to pack so much stuff in 3 minutes on a 3-minute or 4-minute segment is something I will admire for you forever. Like, I just can't do it. I just can't do it. I've been trying. I got tapped by this this local community station. It's like the Fox 8 of Jackson, Mississippi. So I've now done 5 or 6 segments for them over the course of the last couple weeks. And I've been trying. You'd be very proud of me, because I've been trying. Like, sentences are short. Like, the concepts are 1 or 2. Don't pack too many in a sentence. But I just,
so I'll tell you,
many things I admire about you. That is certainly one of them. That's one of them.
So it takes, I literally, for that 3 or 4 minute segment, I put in about 5 to 6 hours of prep, because you have to be ready for the pivot. But the key is you have to talk in 20-second max intervals.
Right.
And that's tough, because you have so much you want to say, and then you have to be ready. You do all this prep, and you have to be ready for the pivot, because they open up rabbit holes, and you have to be careful to stay on task. So it'll come. Just practice.
So that decision in Texas was, in Texas, schools don't have to tell parents of a positive case, but they do if there's a lice outbreak. So again,
wait, what? The schools don't have to tell the parents if the kids test positive?
If there's a positive case in the school.
Wow. But if there's a lice outbreak, holy smokes and Batman. Okay. Yeah. Well, I'm awake.
All right. Well, let's see how we can get outraged, or we can make fun of people, or what have you. Let's see what happens. All right. I don't know. Yesterday, there was an Axios poll. I remember we presented it on Wednesday, so this was Thursday's, that unvaccinated Americans mostly blame foreigners visiting the United States for a surge in Delta variant. Oh, God, that's so disheartening. The first thing we have to read, and here I was going into this thinking we were going to make fun of people. And Jesus. All right, and apparently the White House agrees with them. The administration is taking the first steps toward requiring all foreign visitors in the U.S. to be vaccinated. Travel restrictions curtailing international travel to the U.S. have long been in place with no apparent effect on the prevalence or spread of the Delta variant.
Well, wait now. I see an association, but I don't know if that's loose or not. I think it's responsible that any of us that visit other countries be vaccinated and show proof of a negative test. I mean, that happened going out of the country anyway. So
right.
I don't know if that's blaming them. I just think actually, and I don't speak often on this. I think that's a good policy. If you remember at one point, that would have been a policy last year that people were considering for going state to state, because we have these outbreaks and didn't know where they came from. And it's not I don't think it's a bias. It's a science thing. Like, with all these different variants out there, if you're coming from a hot spot, you need to know. Have you been vaccinated, and are you negative before you come. It's better than saying you can't come in. Which
Sure.
is,
You know what, and that's a fair point. 100% agree with you, Eric. I think what I got tripped up on, because I went back and reread the story, it was this part right here. This is poor journalism right here. To link these two segments.
That's a loose association, like it's
and I got sucked into it. And you and I both do medical journalism, and I got sucked into that. So you're 100% correct. I was too stuck in and apparently the White House agrees with them. But no, it's good public health measure that people, just like if I were to go to the UK, I would expect that they're going to expect for me to be vaccinated, especially coming from the US. I just wanted to say on a happy note here, congratulations, Elizabeth, who is starting physical therapy for her post-COVID long haul syndrome. Congrats. So I got snookered into that one, dude.
Well, I mean, it's easy to do, but it was just the association. I was like, I don't know about that one.
Right.
Let me make an observation, and I mean, you're closer to the bench of this now because I know you're about to set up a lab. I'm not sure where we are with that.
It's established.
Yeah, are we? Because I got asked the point. Are we going to get to the point? It's important now for people to know what variant of virus they have when they have a positive test. And I got asked it, Doc. If I get a positive, will I know what strain I have? And right now, it's no. And they quit tracking, from what I understand, breakthroughs unless you're hospitalized or you die. I guess are we gonna go? Are we gonna go back to breakthroughs? But more importantly, when someone tests, are they going to work on technology? I mean, how long does it take? I mean, there's a lot that needs to evolve for us to do what's necessary, and I guess that's all part of being part of the scientific process. But I have a niece that when she got sequenced or the genetics of, she had the wild type in Atlanta. Yeah, this happened in Atlanta like a month ago.
Really?
Yeah, dude. Yeah. Yes.
Yeah. I've never heard of anybody being told what variant they have. Usually what happens is that all the samples come through, they get tested, the results get sent off, and then the variance lab take those and then they measure those. So right now in New Orleans it's like 90% Delta.
Right. So I'm not sure, but I think it would be helpful for people to know. It would definitely be helpful for people to know what strain or variant they had. I mean,
sure.
That would help dictate policy, and it would on a.
But the thing is that like people want to know the results right away.
Yeah,
and then they would have to like come back later and update their results. I mean, I guess they could do that, but I guess you can go back and look through patient portal or something. But there's just there's no clinical reason for that.
How long does it take to do the genetic sequencing?
They batch them.
Oh, wow.
So they probably batch them and they wait till they get 100 and then they probably just figure that out. And then they send them into a sequencer and then it spits out what the different ones are. So they probably don't even that's what I'm saying. Your niece probably it was done in a lab or something.
Yeah, something. I'll ask her dad to find out how they found out so quickly.
Right, and this is new for me that Delta makes it 93%. The number I've been kicking around has been 80%. So thank you for that update, Elizabeth. All right, going back to our stories here. The UK plans to offer vaccines to 16 and 17-year-olds in the next few weeks. Independent body of scientists that makes recommendations to the government changed its advice. Healthy 16 and 17-year-olds can be offered a first dose of Pfizer without parental consent. So I guess maybe the UK wasn't offering it to those under 18. A recent study published in the New England Journal says children and adolescents transmit the coronavirus efficiently to household contacts, and some of those contacts require hospitalization. The good news, no one in the study younger than 18 required hospitalization. However, the study was done last year before the more dangerous Delta variant took hold. Wow. I thought that was a Delta study for sure. So you have children and adolescents now transmitting coronavirus to household contacts, and some of those household contacts required hospitalization. The Director General of the World Health Organization has a message for countries giving COVID booster shots. Stop it. He's calling for a moratorium of at least 2 months of boosters because we should not accept countries that have already used most of the global supply of vaccines even using even more of it, while the world's most vulnerable people remain unprotected. What are your thoughts on that, Dr. Riggs?
So the fact that we still won't acknowledge that we're all interconnected. We're in a global pandemic. The global health, the world is sick. When one part, if my arm hurts, my hands hurt. If I have diabetes in my hands, it's usually everywhere else. If I need to take my blood, then that's the reason why. If I do a finger stick and I see my blood sugar is high in my finger, I have to regulate what I eat because it's high. It's all over my body. If we have a pandemic happening in one part of the country, if you wait long enough, you're going to see it everywhere, which is, whoa, wait, that sounds familiar, doesn't it? It sounds like we've seen variants that start in other countries like the UK, India. How about the whole this whole thing that started? It began in China, and because we travel and we're so interconnected with travel that it could happen everywhere else. So that means that ideally, waving a wand in an ideal world, we should all have the same resources to fight. So I understand, because the fact that we get it under control here, unless we're going to just say no travel in or out of the country and we're just going to exist that way until it goes away everywhere else, we're going to have to really, really get one voice with this and get on one page. If you remember how when this first happened at the very beginning and we all decided to go inside, it wasn't comfortable, but did you remember the planet started healing? Flatten the curve, and the curve started flattening. But then when one finger decided to stick outside and then a random finger on the other hand, a toe, and now all of a sudden here we are again with a diseased body again. So,
yeah, I mean, I 100% agree with you, but Fetty disagrees with us. Erica, Fetty says this is war. The best offense is good defense. If the booster fortifies against Delta and Delta Plus, we need to use it. We know how to multitask. A moratorium would be foolhardy. The WHO fumbled on this one.
So, Fetty, that is the equivalent of not taking all of your antibiotics for an infection and creating a resistant strain. If you do that, you do that, and just like we talked about patients that were immune compromised that had multiple variants in them because they couldn't get a complete response to shut it down. So we need to get people partially vaccinated. If the sooner we can get this thing to stop mutating and multiplying, the better off we are. The issue with Delta right now and their variant, if these other variants, and I read a lot last night, and there are a couple of scientists that agree with me, that if these other variants are not they don't replicate at the same rate, and at least at the same rate as Delta, then they're not going to be of concern. They're competing like we are. The problem is, just like you see Olympic records broken every 4 years, there's something out there that's going to outcompete it. Instead of 1,000 times 1 to 1,000, it's going to be 1 to 5,000 or 1 to 10,000 that's become more infectious. Delta figured out how to lock into the upper respiratory tract and stay longer, which means that it can be transmitted longer. There's another one.
And more.
And more, and more. But there's another one in the wings. And it can get to the point, eventually get to the point, unless we figure out how to collectively cease this, it can get to the point where we don't have anything. We have no defense.
Eric, what's the one that's out in the wings?
Oh, man.
I was getting my hair cut yesterday, and the barber was like, "All right, Doc, what's next?" I'm like, "Lambda," and he's like, "You mean like lambda, like the nerds?" I'm like, "I don't know."
Exactly. Yes, yeah. Well, this is the true Revenge of the Nerds. Yes, this is
I'm like,
real.
I'm like, but Eric will know the reference, so let me lay it on him. What's the reference of lambda?
Yes, it's the Revenge of the Nerds movie. That's the fraternity. That's the fraternity that the nerds made. Now, and the thing is about that movie, the nerds triumphed. Eventually, science always wins. We can't beat science.
Should I watch it? Is it good?
Yeah, you absolutely should.
Okay, all right.
Yeah.
Maybe today.
The Tri-Lambs. Watch the first one. The first one is the best one. I think the first one's the best one.
All right, maybe that'll take my mood a little bit.
Yeah, you'll laugh. You'll laugh. Yeah, you'll laugh.
The more overall vaccinated, the less likely for mutation, that can get around the vaccines. 100%. And for for that. We don't do it twice in one day, but there you go. That is 100%, 100%, 100%. Yes, yes, and yes. All right. All right, back to our stories here. Let's see what we got. Next here, the UK's Freedom Day, when restrictions were completely lifted, brought screams of irresponsibility and predictions of doom, myself included, and 100,000 cases daily from pandemic experts and WHO. Instead, the British are astounding the world with a drop in cases for 50 in a row. Why is it happening? It's still guesswork, but most speculation is herd immunity, because they are 72% fully vaccinated. And if you factor the COVID survivors with the antibodies, that number could be as high as 92. So that's pretty remarkable.
Get the shot.
Shut up and get the shot.
Shut up and get the shot. And it's on point. Bam.
The head of the CDC says the number of daily cases in the U.S. has surged more than 40% from the previous week. Across the board, they're seeing increases in cases and hospitalizations across all age groups. Moderna believes people who got 2 doses of its vaccine will need a 3rd dose before winter as a booster shot. Shocked. That's why we need a booster shot. No, I'm joking. All right. They're also working on a single shot that would be an annual booster for COVID-19, as well as the flu, as well as RSV.
You called that last summer.
Yeah, that was an easy, dude. That was an easy call. That was an easy call. We believe increased force of infection resulting from Delta, non-pharmacological intervention, fatigue. What? Non-pharmaceutical intervention?
What?
Non-pharmaceutical intervention fatigue.
So that, folks, that means the people are tired of wearing masks and staying isolated and washing their hands. Like
that's right. Will lead to increase in breakthrough infections in vaccinated individuals. California, listen to this. I think this is in the rundown too. California will require all of the roughly 2.2 million healthcare workers and long-term care workers fully vaccinated by September 30th. That's different from the governor said last month. He said workers would have a choice, but the choice is that that choice is the case for Oregon's healthcare workers. The order effectively neutralizes an Oregon law that says employers can't fire healthcare workers for not being vaccinated. So that's a preemptive law that was created in Oregon, in which you have conservative-minded lawmakers that are trying to create a space for unvaccinated people to exist in society, because I think that they see the writing on the wall that it's going to become harder and harder as more and more of these mandates come down the line. Australia's second largest city, Melbourne, got into its 6th lockdown. My goodness. Melbourne joined Sydney and Brisbane and flew in a full lockdown due to COVID variant. The local government said they have no choice because only 20% of Australians
20%. 20%.
Yeah. You might laugh a little when you hear Cable's news channel was operating with employees on the honor system, but that's what CNN was doing, and now it's fired 3 employees who came to work unvaccinated. The head of CNN said the honor system may change in the next coming weeks. We have cases are up 131%, deaths are up 65%, and up over 87% over 14 days. Wow. Yep. So there you go. And of course, Louisiana, the number of most new cases. So this is prevalence. We're a small state, but when you lump us in some of these big states, like all 3 of these states, this small state here, we're keeping up. We're number 1 in the per capita rates.
But I tell you, on the good side of that, though, to be quite honest, and I have to say, you say the bad with the good. It's slowly but surely, we're inching up our number of vaccinations. For whatever reason, people are it's starting to click. It's starting to click. And it's all fun and games until it knocks on your door. That's part of what's exhausting. I'm starting to hear more and more people being diagnosed with positive, but I'm also hearing more and more people, because it's following the numbers, right? The buzz in the community, people reaching out because someone's been put in the hospital or sadly someone dies. And I'm hearing as young as 40. I think I told you I'm hearing as young as 21, and I'm talking about dying. It's going to get closer, and as the numbers go up, we're going to have to be more cognizant of our sniffs and sneezes and sniffles and the summer colds, and most importantly, get tested and take ourselves out of the population. And I'm going back to, I'm thinking about Fetty's point. it's funny that the World Health Organization said that, but no one's really listening. There's a city specifically that is giving a booster shot to people that had J&J because it's the physicians are being asked. The demand is so high from patients, even though hadn't been fully tested. People are doing it anyway. So I mean, it's just it's gotten to the point where people are reading what they say and they're still doing what they want. So
absolutely. 300 cases admitted to Texas hospital yesterday. Average age was 20. Jeez, huh?
Pediatric ICUs in our area where we are full. And the last report, there were 0 vaccinated kids.
Yes, indeed. I will say, I think, just real quick though, China, I think, is donating 100 billion, a billion doses. No, it's in the rundown. I'll get it. I'm sorry, I can't remember. I think it was a billion doses, but we'll see. All right, Dr. Riggs.
2 billion. There it is, right there.
Is it there? Oh, where is it? Oh yeah, 2 billion. Yeah, there.
They also, though, Wuhan decided to test their entire population because they had a small outbreak of Delta.
11 million people.
And they're testing. They're mandating testing for 11 million people.
11 million people. It's amazing.
That's how you track a virus and
Yeah,
behavior.
you're right. Doc Riggs, the first motorcyclists are arriving in Sturgis as we speak for a huge annual rally despite the Delta variant. This here will be responsible for Delta to send us directly into September, because it's going to take a couple of weeks for these people to take it back to their homes and then to transmit. So we're going to be looking at upticks probably going into October, I bet you.
So that's the same thing with Lollapalooza. It's the same thing about the festival that they're about to have is in Iowa that Ed was talking about with 1 million people.
State festival.
So
and
none of that. So folks, for those that are taking the retest and think it's the same test, those are the same questions from last year so that you can get the response.
That's a good callback.
Yeah, we can. If you're
comedy,
checking the box, the answer is B. The answer is B. Do not have the event. That's it. That's the only answer. If you're trying to change it up, like they're trying to switch it up, A, C, D, or E, all of the above are wrong. The answer is B. Do not have large events.
Period. What about people who don't? I was talking to a Vice reporter today, and I was telling her, I'm like, it was occurring to me yet last night that you've got a segment of America who are just like guns. Got to protect myself. Got to protect myself. Got to protect myself. Like the slightest little anything. Got to protect. Got to protect. Got to protect. Got to protect. Right. The vaccine is the most ultimate protection against an invisible enemy. Right. It is the ultimate weapon to protect you from an invisible enemy. And just the dichotomy in the hypocrisy of that thinking is just struck me last night.
So you'll get a kick out of this one. I had somebody yesterday say that I don't want to take the vaccine. Everybody everybody's talking about taking Pfizer and all that stuff. I don't want to take the vaccine because I don't know what's in it. I'm like, really? I said, what about that Viagra that you ask me about all the time? Pfizer makes that. Do you know what's in that? And he walked away. He walked away. Yeah.
You know what my big joke is? When patients ask me, or they get pissed off when they find out how expensive Pfizer is or whatever, there's 2 things insurance companies don't pay for. Do you know this?
What's that?
Boners and sleep.
Yeah.
Medications to help you sleep and boners. Those are the 2 things insurance companies do not pay for. So, in case you were wondering, there you go. Anyway, all right. There's some doctor humor for you. All right, so Sturgis is happening. We will be reading about Sturgis very soon. No, dude, it was like it occurred to me on the other day. I was like, hey, isn't Sturgis supposed to be happening? Wow. And then right, and then all of a sudden, yes, indeed. ended up happening. I remember it was early August. I remember that. All right, let's see if there's any more good. So yeah, this is interesting. The FDA is aiming to speed extra vaccine doses for immunocompromised patients. This is something that we've seen. There are studies that show a third dose for people who are immunocompromised has been positive. China will provide 2 billion vaccine doses. Like, yeah, excellent. New data suggests J&J vaccine works against Delta and recipients don't need a booster shot. I need to look at that data. That has not been any of the stories that I've seen, but I'll look into that. And the pandemic has deepened global hunger, with poor countries sinking deeper into crisis. And this is something that we've been reporting on for a very, very long time. I hate having to read that news. Going a little deeper into stories. Here's the story. California.
I want you to go back to that J&J thing real quick. I'm sorry. I just want to make a point. The reason that I push back against unresearched, fully researched doses is because in medicine, you can't predict always how the body is going to react. The answer in medicine, isn't always more. And you want to be careful at the tipping point of it. And a great example is vitamins or water. Even there are people that you can overhydrate and end up having a seizure, throw your electrolytes off. That's the whole point of clinical trials in doing them, so we can see exactly what might happen, safety and efficacy of doses. What's safe? What's the tipping point? How close can we get to the threshold before we cause something bad to happen? And you want to do as best you can to take things that are researched, even though people take supplements all the time. There's no, you don't even know what's in it.
But Dr. Griggs, you're speaking so eloquently about clinical trials. Are clinical trials on your mind?
They are. I wonder why.
Dr. Griggs and I are working on an animation on clinical trials.
Yeah.
That's funny. And for those of you who just to remind you guys, Doc Griggs did clinical trials for the first 10 years of his career. Chris Rock told Jimmy Fallon that he got the Johnson & Johnson. He called J&J the government cheese.
So, Fetty, if you could just elaborate a little bit, how is it the government cheese of vaccine?
No, I think it's because it's
Does it have a red? Is it red? And when you slice it, is it red around the outside? And that government cheese made the best. I will tell you that, made the best grilled cheese on the planet. Let me tell you. The government cheese of vaccines. I love it. I just need to understand it, but I love it.
All right. California's requiring all healthcare workers work indoors. This has been issued. They have until September 30th to get a single dose vaccine or the second dose. And just last week, Governor Newsom included testing as an alternative, but that ended up being reversed as well. And you're seeing major employers like United Airlines, Google, and Disney are announcing vaccines as well.
Yeah.
All right. Although most large events shut down last summer because of the coronavirus pandemic, the Sturgis motorcycle rally forged ahead, panicking health workers as nearly 500,000 motorcycle enthusiasts.
Folks, this is an open book test. Let's go back and look at what happened last year when they did this, and then maybe you can get an idea what the answer would be as to whether or not to have it this year would be. But from what I understand, they expect it to be even larger.
Hundreds of new cases were linked to the event, but the true tally was obscured because affected bikers returned to their home states, making contact tracing difficult. This year's rally, which began on Friday, is expected to draw an even larger crowd, just as the infectious Delta variant is producing more new virus cases nationwide than this time last year. What the path the virus will take through Sturgis this year remains to be seen. Transmission is more difficult outdoors. Vaccine greatly reduces the risk of serious illness, and South Dakota has the fewest new cases per capita in the U.S. At the same time, the CDC says that Delta is as contagious as the chickenpox, far more transmissible than the colder seasonal flu. But people are traveling from across the country. Several southern states are in their worst outbreaks to date to a region with relatively low vaccination rates. Sturgis officials emphasized that the rally, which lasts for more than a week, would offer coronavirus tests, free masks, and hand sanitizer stations in an effort to limit crowds inside bars. Attendees will, for the first time, be allowed to carry alcoholic drinks outside without fear of being fined. It's so funny that, that they changed these archaic laws, at a time when they need it. They're like, yeah, that law no longer serves us good. We should just let them bring their drinks outside. I have a feeling we are going to see a massive, massive super spreading event happen. We're going to see stories. Hear me today, quote me tomorrow. You're going to hear stories in about 4 weeks that are going to be like, I should have never gone to Sturgis. You're going to hear that from a guy who's on a hospital bed with a wife who's going to be shakily holding an iPhone, tearing up because her husband is slowly dying from a pneumonia on top of other pulmonary infections like COPD. That's a
very macabre picture. Oof.
But mark my words, that will happen. Just like we were able to predict that people are going to be saying, "Can I get the vax?" just before they're going to be intubated. Like, these are things that are easily predictable. These are not.
Well, that's happening right now.
I know that, but we predicted that like 4 or 5 weeks ago. We predicted that some time back. We were like, you don't get vaccinated now, next surge, people are going to be begging for vaccines. These are things that are easily predictable.
Yeah, it's unfortunate. And again, I mean, you see the what we learned and what we're trying based on what happened. It has low vaccination rates, but they're going to be offering. This is the first time you've ever seen me take notes. But they're going to be offering free masks and hand sanitizer. That's a step. If they offer, and they might even get to the point they're offering testing and vaccines. But folks, it's not enough. This virus, for every 2 people that were infected last year, the R naught is one. It's 8. So 8 people now. It's instead of 2 to 2.5 or 3 people, it's 8 people. It's that much more infectious, and the concentration is a lot higher. It's sitting in your upper respiratory system longer, which makes it even more transmissible. So, I mean, we still got a long ways to go before we can be like, okay, we got this under control. So, I guess someone has to try. We got to try. And we'll learn from this. Maybe next year on the test we'll get it right.
Segueing into more super spreading events. More than 900 students in quarantine after second week of school in one Arkansas district. More than 900 students and 12 teachers are in quarantine as the second week of school comes to an end in Marion, Arkansas, as the district grapples with an outbreak of COVID-19. 47 students and 8 staff members tested positive this week alone, causing the jump in students needing to be quarantined, an additional 54 students and 5 staff members. The latest numbers are being tracked in the district's online dashboard, which says the district is committed to being transparent. Well, that's good. CNN previously reported that the district has not been able to put a mask requirement in place due to the law that Governor Asa Hutchinson in April signed. Now, Governor Hutchinson now says that he wished that had not become law. So the district, which is west of Memphis, Tennessee, said if that mask mandate was in place, the number of students in quarantine would be drastically lower. Moving to another southern state, Georgia's largest school system confirms 253 cases of COVID. The Gwinnett County Public Schools confirmed at least 253 cases of COVID-19 for the first 3 days of classes.
Wow.
That is what we are dealing with right now. This is what we're dealing with. And also the third story here, the schools where COVID-19 is spreading are not following mitigation measures. Yeah. Schools and summer camps where COVID-19 are the ones that have not been closely following mitigation measures. I mean, again, this is exactly the same thing. I mean, what can we do? You know, you said that was a macabre example, and I pushed back and I'm like, but look what's going on. We know what to do, and people aren't doing it. And what do you do? Like, this is like, you know, this almost seems like the end of a BOK segment where we're just like scratching our heads because we've talked through all the science, we've talked through all the good stuff, and we still can't get folks to do the right thing. I'm not saying people listening to BOK aren't. It just feels like, you know, we exhaust all, we exhaust all of our possibilities, and then we're just left with, I don't know,
You know what's really hard to regulate, and it's sad that that responsibility has to be on them, is the school buses. You mean to tell me that the kids? I mean, you want kids to wear masks on a school bus and keep them on the entire time that they're riding? Like, I don't know. That's kind of hard. That's kind of hard to monitor.
Yep.
On top of everything else, the bus driver has to monitor while they're trying to take our kids to and from school. I don't know.
Yep, and I agree with Ann. What in the world has happened? Folks need to wake up and they need to do the right thing. All right, let me skip through the rest of these stories and go. Had so many good stories. I had one story here. Unvaccinated Americans are causing a needless toll on the U.S. I just had so many good stories. 1 dose of COVID-19 vaccine may be enough for previously infected. You and I had talked about that a number of times. All right, but let me get to
quick aside. I'm also hearing from my colleagues, our colleagues, nurses and doctors and other folks that work. Everybody, a lot of people that work in hospital environment, they're tired.
Yep.
They're really, really tired.
Yep.
This is they feel like it's unfair because we stepped up at the very beginning to prevent it, and they feel like this could have been avoided. So I mean, burnout is real. There's a shortage of nurses across the country, from what I understand. So,
yep.
And when nurses are really the heart and soul of a team, like,
yes, indeed.
yeah. I mean, as are a lot of folks, but I just know the value of nurses to my education and support and all the stuff it is that we do. The MAs, the custodians, the transport team, the people that answer the phones. I mean, we're all in this together. But I mean, if we run out of a shortage of any one of those, we're in trouble.
Absolutely. And look at the overlap of these dates. People coming from Sturgis, then going to Iowa State Fair. What's the likelihood of that happening and then transmitting even further? I mean, it's unbelievable. We got like 7 minutes. Let me go through this really quickly.
Yep.
I'll just last night we added a total of 706,069 cases, 10,000 deaths. Here we are. We're just now reaching and surpassing over 700,000 cases daily. Let's see if we're seeing a 14-day change increase in 17%. So it looks like I don't want to say it's maybe tapering off. To me, it seems like this is still continuing. Deaths.
Every time you say that, you don't say that. No.
Right. Yeah. Deaths have gone down apparently 17%. It still looks like it's going up to me. And when you look at the number of cases per region, you can see the U.S. is far and away leading all other cases. And when you look at hotspots around the world, you see multiple hotspots, multiple continents. Delta is quite literally all over. You can see South Central and South Central Europe. It's just it's unbelievable what we're looking at. And here you can see Haiti. That's Haiti, right? Yeah, I think that's Haiti. That's Cuba.
Cuba.
Yeah, this is Haiti, and this is the DR. Cuba's on fire with cases.
We got a lot going on down there.
Yep, yes, indeed they do. So that Delta. All right, what else we got here? We'll skip through these slides. U.S. 36 million cases, 36 million plus cases, 632,258. We're now up to 122,450 cases. Deaths are still stable at low, 571. And here you can see that this was the last time this was Wednesday. So from Wednesday to Friday, we jumped up 27 per 100,000 to 30 per 100,000. We went from in 3 days. These are 7-day rolling averages. In 2 days, we went from 93 in Louisiana to 99 per 100,000.
Yeah, we got to work on that.
Insane. Yeah. Mississippi went from 64 to 70. Arkansas went from 62 to 69. I mean, Alabama 57, 53 to 57. Of course, all states in the South, all states in the South that are purposely not choosing to do, of course, the right thing. Cases are up, deaths are up, hospitalizations are up, test positivities down just a little bit, 9.3, which is great. When we look about the CDC 100 per rate per 100,000, just last week, 2 weeks ago, it was in the 50s, 90s, 133, 177, and now we're at 189, 190 per 100,000 per 7-day case rate. Looking at the U.S. is really, really exploding in cases. Hear me today, quote me tomorrow. Sturgis, Iowa State Fair, Lollapalooza. But Lollapalooza, at least she had to be vaxxed and maxed, or at least vaxxed. But the Iowa State Fair and the Sturgis, there's none of that stuff's going on. These, mark my words, hear me today, quote me tomorrow, without question, super spreading events that are coming up. You can see testing is going up, as Dr. Griggs lying or stating at the beginning of the hour. Hospitalizations are going up significantly, and deaths are reporting, well, it says here, 735%.
Lagging indicator.
We have now reached fully vaccinated, 50%. So that was kind of the big news. That was one of the stories that I was going to present today. So we are at 50%, better than nothing. I'll take it. I wish it was more, unfortunately. And just in the last couple minutes, just to show you, Louisiana is still far and away the #1. And just look at the density of red in Louisiana. Just look at us here, dude. It's a shame. It is.
We got work to do. We got work to do. We'll pull it off. We got work
to do. We do indeed. Looking at Louisiana specifically, we added. Thank you, Ryan White. We added 5,468 cases, and look at this. Just these numbers are just far and away blowing away. Why we don't have an outdoor mandate, mask mandate, I do not know. Looking at COVID Act now, we went up from 93.1 to 96 per 100,000. Our infection rate is down. It's more or less the same, 1.3. Test positivity more or less unchanged. And vaccination rate up just a little bit, as Dr. Griggs was talking about. There has been an increase in vaccines. In Orleans Parish, we are in severe. We went from 81 per 100,000 to 85.5. Infection rate more or less the same at 1.3. Test positivity more or less the same. And vaccinations went up just a hair. So we have, as Dr. Griggs said, we have a lot of work to do. And with that, go ahead.
So real quick, y'all, I had an epiphany yesterday. I did a panel, and everyone, they got comfortable enough to really talk to me. If you run into someone that's not vaccinated, don't bombard them with stats. Part of the problem I'm hearing in hesitancy is that a lot of them are genuinely scared, and there's a level of anxiety, and they're judged, and it makes them draw back. Take the time to ask, let them fully ask their question and address it with facts, and hear them. And I'm talking to especially the younger groups, because it's happened. They've changed their mind. They want information. They feel like, want to understand that we haven't been fully transparent with them about the severity of the situation. So just, if you can, engage in discussion, make sure you hear them first. And the hardest part is to quell your emotion in the conversation, because once you get upset, they feel like they won, or they're not heard. That's all I have to say.
We love you guys. Doc Griggs, have a great weekend. Stay safe.
Health is a human right.
Health is a human right. Get checked, get fit, get moving. Everybody, peace out. We will see you guys on Monday. We're good for Monday, right?
Yep, Monday.
We'll see you guys on Monday. Please stay safe. Please mask up. Please encourage all the people around you to get vaccinated. Thank you guys so much for tuning in.